And it's my pleasure to introduce tonight's speakers, Crystal Lowe-Pierce and Anna Pignol. And Anna and Crystal are PhD students, Crystal at Dalhousie University and Anna at the University of North Dakota. They're both PhD students in clinical psychology, and they're here as psychology residents with us this year at the IWK. And the residency program is a one-year clinical training program, and it's the last step before graduating with your PhD. So these are very highly trained people that we're delighted to have with us this year. And both Anna and Crystal have worked with a number of children with health issues over the year, as well as developmental disabilities around issues of toilet training, as well as many other issues. And we're really pleased to have their expertise here tonight. So without any further ado, I'll turn it over to you guys. Thank you.
Thank you for that introduction. And also a big thank you to both Dr. Backman and Dr. McLaughlin for all of their input on this presentation. Thank you as well to Brian for organizing all of this AV stuff and making sure that the telehealth sites can hear us and see us clearly. We're very happy that everybody could make it, whether you're here in the room with us or you're joining us over telehealth. We look forward to having you here. We hope you find the information we're presenting to be useful. We are going to go through the presentation now, and we will have a question period at the end. So if you have any questions, please save them to the end, and we will have time to address those the best that we can. There are handouts on the back table, so if you haven't gotten one, please feel free to go and grab one. And other than that, just to give you a little bit of an idea of what to expect, here is just an outline of what we're going to cover today. We're going to go over just some general introduction and preparation for toilet training, and some of the information that we're going over may seem to be fairly general. It could be for normally developing children or children with special disabilities. Basically, the principles are the same no matter what issues your child has, so that's why we're going over it in this way. But we will also go over some problem solving and some ways to encourage your child with toilet training and try to cover all of those bases for things if things get a little tough in that area. And then finally, we will spend some time talking about both constipation and bedwetting as specific topics. So just to give a little bit of an idea when to start toilet training your child. It's basically for a normal developing child, the range is from 2 to 3.5 years for starting toilet training. And the fact that there's a range there means that as soon as your child turns 2, it doesn't mean that, okay, today's the day we're going to be toilet training. There's a range because children develop at different rates. They have different personalities and learning styles, so it's very important that you're making sure your child is ready. And certain children may be outside of these ranges as well, and that's okay. It's something, don't get all caught up on there's a certain age and this has to be done right away. You want to give yourself some time and realize that these things happen when your child is ready for it to happen. Toilet training is also a process. It's not something that happens overnight. You don't want to look at it as, okay, we're going to spend this weekend and toilet train my child and then everything's going to be fine after that. It's not quite that simple. It's a lot for the child to learn. There's a lot of different steps in it when you think about breaking it all down, and it's a brand new skill for them. So it's something that's going to take some time just getting them used to the idea, as well as practicing and having some times where they aren't as successful and times when they are successful. So have patience when you're about to start this because it's something that does take a bit of time. Just a little bit of a note on some of the concerns that parents or caretakers of children with special needs have. Some things that they worry about may be that the child doesn't have the necessary skills, or if they haven't been toilet trained, maybe you're worried that they're too old to be toilet trained. Other parents may worry that children can't be toilet trained because they have a specific disability or syndrome. And these are all myths. This is something that any child can be toilet trained. You may have more challenges with certain children. You may have to adapt things or break it into smaller steps or start them at a later time, but it's something that's worth the effort to try to teach them and find out what works for your child. So there may be some barriers there, but it doesn't mean to just give up on it and never try to toilet train them, because there are definitely some advantages for the child in being toilet trained. So a few things is how to tell if your child is ready. The first thing you want to look at is basically, are they physically able to be toilet trained? And this has to do with whether or not they can stay clean and dry for at least 30 to 60 minutes. So that's, are their bowels and bladder developed to the point where they actually have some control over this? And as long as they can stay clean and dry for a short amount of time, it doesn't even have to be a very long amount of time, then you can work on toilet training your child. Ideally, it'd be great if the child is able to raise and lower their pants. Obviously, that makes it so that they are more independent if they don't need your help. This may be absent in certain children if they have special needs, or even if you just decide if your child is ready at a younger age, but they don't quite have the dexterity to unbutton the button on their pants and stuff like that. That's okay, as long as you're realizing that it's going to take, they're not going to be completely independent on this. They may need some help through some of the process. But in an ideal world, if they could raise and lower their pants, that's definitely a good step in the right direction. Another thing you want is they have to be able to understand simple directions. So if your child is not understanding what you're asking them to do, it's going to be very hard to teach them about toilet training. This communication, though, doesn't have to be verbal. This could be something you're showing them. You can use gestures, nonverbal things, pictures, any way they can learn, but as long as they can understand the simple directions. If you have a child that is not physically dependent, if they're not physically independent, then you have to make sure they can communicate with you. Because obviously if they need your help to get to the bathroom, or whether it's raising and lowering the pants, they have to communicate with you. It's pretty hard for you to toilet train a child if you don't even know when they have to go. And again, though, this communication doesn't have to be verbal. So they might say, I have to go to the bathroom, or they may have a symbol or a sign that they make to let you know. So however they communicate, they just have to let you know that that they need some help, and then you can take from there. So I'm going to turn it over to Crystal now, who's going to go in more detail about some of the early preparation and other things with toilet training, and then I'll chat with you again later.
Thanks, Anna. And Anna and I both have colds, so you have to excuse if we're running for water and cough drops. I'm going to talk about the different phases of getting ready and getting started with toilet training, and then I'm going to hand it back to Anna to talk about some specific issues that you can encounter. And for those of you who are at the feeding talk, you know that I have a toddler who's 2.5 as well, and I know that toilet training is a process, and it's not an easy process. So I'm going to talk a lot about early preparation before you even start toilet training and how to get your children ready for toilet training. Then I'll talk about introducing toileting to your child, and then we'll start to talk about kind of getting a little more intense with the toilet training. So hopefully by the end you'll have a good sense of how the whole process unfolds. So as far as early preparation goes, Anna's already mentioned about raising and lowering pants. And this isn't a necessary skill, but it's a very helpful skill, and it's especially helpful in helping your child to be an independent toileter. So somebody who can go to the potty or go to the toilet on their own, pull down their pants and pee or poop when they need to. That is obviously later on in the process, but it's a helpful step to keep in mind. And especially for typically developing children, it's around the same time that you're starting to do toilet training, they're also becoming quite interested in dressing themselves. So they're interested in learning how to put their jacket on or pull their shoes on. And learning how to raise or lower their pants is a natural part of this as well. Sometimes children just do this on their own far before you want them to be able to do it as well. Sometimes you have kids that are pulling their pants down with poopy diapers on, and that can get a little messy too. But it's a skill that's helpful to teach them. And sometimes it's one that you'll want to teach them early on, before you ever even think about pulling out potties and books and talking about toileting. It's something that you can teach as a very discrete, separate skill, and it's something that you can reward and reinforce in and of itself. So teaching them the steps of it's especially helpful if you have elastic band pants, of just pulling them down, and how do I kind of navigate getting them back up when I'm finished. The other thing that you can do very early on, and most of you who are here tonight, I'm sure, have already thought about how you're going to teach your children the vocabulary or the communication around toileting. And this can be done in a variety of ways, and there are lots of books. We have some books and videos up here, and some of these books are actually from the family resource library that we have here at the IWK. And if you don't know about that, it's a family library that you can take books in and out of for a week or 2 weeks, and there's no charge or anything. You just need to sign them out and give your phone number. So there are books on all sorts of different issues, all sorts of different typical developmental milestones, and all sorts of special needs. So it's something to be aware of. And there are a few books here and a video here from there that I haven't viewed the video. I'm not sure what it's like, but just to give you a sampling. And then we have some other books over on the corner as well. So it's just a sampling of books. It's certainly not at all an exhaustive list. There are lots of books out there and videos out there that you can watch with your children. You can start to talk about toileting, start to use the vocabulary. It's really helpful if you have consistent vocabulary. So, using the terms pee and poop or whatever you choose to use. If mom and dad and other caregivers can use the same vocabulary, that's less confusing for your children. So it's helpful to use consistent terms. The other thing that you can do is you can use, there are lots of dolls and potties out there now too, and you don't have to go buy a special doll and a special little potty. You can also just use the potty you have that you're going to use with your child and use a doll or a stuffed animal that they have. So there's lots of different ways to get familiar with toileting vocabulary. It's also important that your children are able to follow basic instructions. And this doesn't have to be complex instructions. This can be simple instructions, but you can practice it with your child, again, outside of the realm of toileting. You can practice things like when you're playing, can you give me the toy? Or you can ask them, come here for a minute, or let's sit here and have them sit while you're reading a story. But getting them used to taking instructions from you and being able to sit for a short period of time. And lots of times when you're doing toileting, you'll actually read to your child anyway. So getting them used to sitting and reading a book with you, for example, is a good way to have them follow your instruction of coming and sitting. We don't want them sitting on the potty for long periods of time, but just short little sits are good to get used to. After you have the vocabulary down, and you've talked about toileting, and you've decided on the terms you're going to use for toileting, becoming familiar with the potty or toilet is also a really good early preparation step. So sometimes when parents get kind of in their head they're going to start toilet training, they go buy the potty and they take it home and they want their child to sit on the potty and we're going to start tonight and they're going to have success tonight and I can't wait. It doesn't often work that way, as most of you who are here tonight will know. Usually it takes some getting used to. So bringing the potty into the home and having it kind of somewhere where they can see it and get used to the potty and they can ask their questions about the potty and you can comment on it. And then also modeling toileting. So pairing the vocabulary, whether it's verbal or whether you have some nonverbal gestures or nonverbal ways that you're talking about toileting, pairing that with them actually seeing you do toileting. And maybe, depending on your comfort level, you may not be comfortable with them watching you use the toilet, or maybe you are. Different families have different comfort levels with that. But even just seeing you regularly going to the washroom and commenting that, oh, it's time to pee before we play, or something like that, and getting them used to modeling that toileting is a normal part of everybody's daily routine. And again, we had talked about you don't need to have a special doll and a special potty to do it. You can use a stuffed animal that you have in the toilet or the potty that you've chosen. There are lots of different ways to model. Whatever gets your children's interest. In the early preparation phase, there's often the discussion about what is best. Is it best to use the toilet or is it best to use the potty? And there's no right or wrong answer to this question. It really depends on the developmental level and size of your child, and it also depends on what your goals are and what your child's interests are. So sometimes parents are concerned if I start with a potty, then we're going to have to transition them one more time to getting used to the toilet. So let's just start right away with the toilet. But sometimes children will have seen their little friend or somebody in the daycare using this really cool little potty, and that might motivate them. They want to be a big boy or a big girl now, and they're really motivated to try the potty. So you need to think about what's going to grab the interest of my child and what meets my goals as a parent. As far as size and developmental level of your child, the main thing that's important is to make sure they're comfortable and well supported, and to make sure that their feet are supported with their knees higher than their hips, and that's going to help them to have the best success. So you don't want their feet to be dangling. So if you do choose to use a toilet, it's really important that they are well supported, and I'm going to show you a few pictures of some adaptations you can use around that. But before I talk about toilet, if potty is your method of choice, if you decide to use a potty, even as your child gets older, and if you're starting out or older, or if it's taking a little longer than you thought it would, there are commodes that you can also get that get increasingly larger, so you can get commodes right up to adult size. So you can still use a potty, if you will, even with bigger kids. So don't feel like you're limited to having to start with the toilet if your choice is to start with a potty or a commode. And here's just a few pictures of adaptive devices that are available. In this picture, the little girl has a step ladder sort of thing that she's able to get up on the toilet. There's a foam inset so that the hole isn't too large for her, so she can feel comfortable and support it on the toilet. And then she has the handles on the top of the ladder that she can also hold if she needs that extra support. also something that goes on the top of the toilet to make the hole smaller, make the child feel more supported on the toilet. The neat thing about this is that it flips up with the toilet seat so that you never have to take it on and off. So an adult can use the toilet or the child can use the toilet and flip it up and down. And this is an inset that you can get that goes in the toilet. You would take this on and off when you were using it as an adult. And this one's for a little boy, so it has a little cup at the front that deflects the pee if he happens not to be aiming the right way. So, but again, it's just supporting him on the toilet so that he isn't feeling like he's going to fall in. You don't want little children feeling like they're going to fall in the hole. The important thing that is not in this picture, and I don't believe it was in the picture before either, okay, you can't tell here, but it's not in this picture, is that their feet would not be supported here unless they're quite a large child. So with this situation, you would either want to have one of the little ladder things that were in the first picture, or you would want to have just a basic step stool often works. You'd have to kind of investigate the size for your child, but you want to have their feet supported again so their knees are slightly above their hips. So often if they're big enough then that they can be off a potty and on the toilet, a step stool will work. And the nice thing about a step stool is they can climb up on the step stool and get on the toilet themselves and then sit. And I'm going to show you a few more things with it. We have some devices here, which I'll just show you a little later in the talk, that can also be used as adaptations. The other thing that's really important when you're in that early preparation phase, before you even start at toileting, is choosing the right time. And you need to consider competing priorities for both the child as well as for you as a family. So what sometimes happens is, sometimes parents will feel that they need to start toilet training because their child's going into daycare and they have to be toilet trained for daycare. Or there's a new baby on the way and they really want their older child trained before baby arrives. Or another situation like that where they feel desperate, I need to have my child toilet trained. And that's sometimes the worst time to start toilet training. Because what happens is that's a time when you already have lots of stress occurring in the family, you already have lots of things going on and lots of changes. And for both the child as well as for you as parents and caregivers, there's only so much of your mind that can go around. And so resources are already allocated towards dealing with all these other changes. And to be able to concentrate just on toileting is actually really difficult. So kind of counter to what you think, it's actually better to start toilet training when you have lots of time to put into it, not when you're feeling really pressured. Because the pressure doesn't work for you. It leads to frustration and wishing that things would go faster, but it also leads to frustration and feeling pressured and sometimes some resistance from the child. So choose a time that there aren't lots of competing priorities and a time that you can really focus on this. Okay. The other thing that's important is to think about how your child has learned other new skills. So by the time you're ready to start toilet training, your child has learned lots of other things. And it's thinking about how your child learns best. So some children learn best by watching mom and dad or watching someone else do something, and they're more visual, and you feel like they soak everything in just by seeing you do it. Some children learn best by reading books with you about it, and you chat about it, and they like to talk about what they've seen, and so they're more verbal learners. And many children are a combination, where they really benefit from chatting about things and reading about things, but seeing it in action as well. But just think about, before you start toileting, what would be best for my child? What do I think would work for her? What has worked when she's learned other skills or he's learned other skills? Also, it's often important to break the steps of toileting down into smaller steps. So I'm going to talk a lot about rewarding success on the toilet, but sometimes just rewarding even sitting on the toilet is a step that's more important, or even just going towards the toilet. So it really depends on the child, but you often have to break it down into much more discrete steps than just kind of bringing the potty in the house and wanting them to sit on it. Sometimes you really need to break it down. So we're going to talk, because we don't have a whole lot of time tonight, quite generally, but we may need to break it down quite specifically when it comes to individual children. Okay, so you have the potty in the house, you've introduced the potty, they've seen you do toileting, you have lots of vocabulary that you're using consistently with them. You've found a way to use either verbally or non-verbally to talk about toileting and have them indicate to you that they're going, or you can tell the signs when they are using the toilet. Now it's time to introduce toileting. So the first thing that you need to do is provide lots of opportunities for them to use the potty or use the toilet. How do you do this? The best way to do it is to encourage regular trips to the bathroom, and this can be based on yours and your child's schedule, so you can find what works for your family. But by now, you probably have a sense of when your child's most likely to go. So chances are, just from doing all those diaper changes for 2.5, 3.5 or more years, you have a sense of how often they're peeing, and you have a sense of when they usually poop. So you want to try to get them on the toilet or on the potty around those times, kind of on those time frames. But you also want to go with your schedule and build it in that it kind of happens regularly at routine times. So before you go out to the car, you always go to the potty or always go on the toilet. Or before you go out to play, you always have to do a potty trip first. That type of thing. So you want to make it a regular trip. And the reason why you really want to make regular trips a habit is because the first couple of times your child has success are likely going to be fluke. So if they're on the toilet regularly or on the potty regularly, chances are at some point they're going to accidentally pee. They're sitting there, they don't have their pants on, they're on the toilet, you're reading them a book or getting them to try to sit there for a few minutes, and oh, they peed. That's when you want to have a big party. So you want to make it really positive. You want to really make them notice the difference between kind of when life was boring, when they were going in their diaper, and when they went on the potty and suddenly, wow, you did it. And you want to have that big party to let them know that they really did it. Okay? So, and the other thing that I didn't mention just from the previous slide is you do really want to always keep toileting positive. So when I say have a big party, I don't mean be upset when they don't. So there's a difference here. You never want to punish or scold or make a big deal about it if they aren't willing or aren't having success. But what you want to do to make it different for them is make it boring. So boring is the key word. So very neutral, very little attention, just matter-of-fact cleanup, and we'll try it again next time. But when they do have success, or they are, if your first step is just getting them to the potty and they're actually sitting on the potty, that's when you want to really up the praise. So that's the difference for them, is neutral versus party. It's not scolding and punishment versus party. Okay, you'll hear me mention that lots. The other thing to keep in mind when you're very early on introducing toileting is that it's really normal for your child to continue to urinate and have bowel movements in their pants. This can be really frustrating because you've seen success, so you know they can do it. So then you really just want to keep encouraging that success. And it can be very frustrating when, especially if they've had success quite a bit, and then all of a sudden big accident or they poop in their pants or what have you. But it's very important, again, that you just remain really neutral and keep your attention to a minimum during cleanup. Don't scold, punish, act upset or frustrated, and move on and try again. These accidents will happen in those early stages. Okay? But once your child has some success and you know they can do it and they're more regularly going and you're not having difficulty getting them to the potty and you're able to praise all those times that they're doing it and having good luck and having good success and working hard at it, that's when you can feel confident in increasing your expectations around toileting. So that's really when you can up the ante, if you will. You want to really kind of start to expect more from them, but while you're expecting more from them, remembering that toileting is hard work. It's hard work for you as caregivers, and it's hard work for them as children. So it's important to continue to provide them with lots of positive feedback when they're doing well. So they've had success quite a few times at this point, and they're having the occasional accident, but when they have success, don't forget to keep praising them. So don't just assume the success. Keep the party going, because it's still hard work for them, and they're still trying to figure all of this out. And consistency between caregivers is really important, so whenever possible, if mom, dad, grandparents, and daycare can kind of be on the same page with the toileting routine, that really helps as well. And just a little bit about rewarding your child, and this is where I talked about that it's hard work for them. As adults, we go to work because we get paid, and if we stopped getting paid to go to work, we wouldn't be very motivated to go to work anymore. And if we did go to work, we wouldn't be very motivated to work very hard. And for children, it's important that they also feel that they're getting something back for their hard work. And what they get back for their hard work is those rewards and that reinforcement and that praise from us as caregivers. So we're really providing them with that feedback that they're doing a good job. And eventually that becomes internal. Eventually children start to realize through natural consequences that they're doing a good job and that it's better to go on the toilet than it is in their diapers. But in the beginning, we really need to provide them with that feedback. And again, rewarding small steps in the process can be really helpful, and not losing track of the fact that we really do need to keep giving them that positive feedback. So what kind of rewards can we use? And there are many different options. And for those of you who have started potty training or have read books on potty training or started to look into it, sticker charts are one that are common, and you see them on every diaper site and every Huggies pull-up site, and you see them all over the place. And there are lots of different types of sticker charts you can use. This is quite a busy one, and you might not choose something this complicated. You might choose a very simple sticker chart. You may not choose stickers at all. You might choose other things to let them know they're doing well. Praise is one that we would always encourage go with any reward that you're using. So even if you're using a material reward, we would always say to pair that with some social praise, letting them know that you're proud of them and they're doing a really good job. But sometimes children are motivated by other things, calling to tell grandma, or a special phone call, maybe not about the toileting, but a special phone call to a friend. Sometimes special time with mom and dad above and beyond what you'd normally do, watching a movie or having special TV time. You can use toys, but we would say always keep it really small. And it doesn't matter if you're a millionaire and can afford the best toys in the world, you still want to keep it really small because we want you to be reinforcing and rewarding them often. And you can't maintain it if you're going to give them a big toy or a big prize every time. And it's not going to be motivating for them either if they're getting something huge every time. It's going to lose its I can't think of the word, but it's not going to keep the same value for them. But a grab bag of dollar store toys or a grab bag of even just little certificates with written out special time with mom or a special TV show or something like that can sometimes be really motivating, especially if they don't know what they might get. Picking a treat from the candy jar or choosing a special dessert. Again, it doesn't have to be a material thing. It can be something like going to the park or having a special story. It really is important that everybody keep in mind that these rewards don't need to cost money. That sometimes the things that don't cost money are just as motivating or more motivating for children. So it's finding what works for your children and what motivates them and what they might want to work hard for. The other thing I will mention later on again is that it's sometimes important to change up the reward system. So what works one week might not work the next week, so you kind of have to keep thinking. It keeps you busy as caregivers. But the main thing is that you want to find some incentives that will increase their motivation, which will ultimately increase their chances for success, and then you can pair that with some praise. Ultimately, parental attention is the best reinforcer. You don't want to give parental attention to undesirable behaviors. What we want to do is make that really neutral. So the undesirable behavior in this case would be not being willing to sit on the potty or not sitting long enough to have some success, or even sitting there for a while and not having success. You want to just kind of make that boring and then give the party for the desirable behavior. So you really want to give lots of attention. And that's we want to give, it's called differential attention. It's differentiating your attention from the undesirable and giving them lots of attention for the desirable. Excuse me. But sometimes, even when you've been having lots of success and things are going really well, and most of the time they're going on the potty, all of a sudden things seem to plateau, or all of a sudden things seem to go backwards. And as parents and caregivers, we're like, what is happening now? I don't understand this. And so we're going to problem solve a little bit here tonight, and then if you have specific questions at the end, we can try to problem solve with you as well. But the first thing you want to do is rule out any physical reasons. And chances are there's not a physical reason why things have plateaued or things seem to have gone backwards, but you do want to rule out urinary tract infections or constipation or a medical reason that might be causing them to have some resistance around toileting or to be causing them to have some accidents. Probably more likely you want to look at other stressors in the child's life, other things that have changed or other expectations that have been placed on them, and have those cause the resources that they can put into toileting to kind of be depleted a bit. So sometimes changes like a move or a new brother and sister or going to school or changing daycares or even just daycare being on a break and they're in summer camp, or there's lots of different things that can put stressors on children. You also again want to ensure that your child is seated comfortably and is well supported. So we've talked about this already, and I'm going to emphasize it again. The other thing is that you want to make sure the system that you established early on when you started toilet training is still working for them. So if toilet training takes a while, which it often can because it's a process, sometimes the children are growing all that time. So is what you were using originally still fitting for them, and is it still supportive for them, and are they still comfortable? We gave some pictures before, and I do want to point out a few things here as well. And Anna's going to be my Vanna White and hold things up because I can't take the mic with me. But we do have a few things for children with special needs here, just as children get bigger. The first one I'll talk about is this one, and it's just the child can sit in it, and the tray comes off, and it actually slides over the toilet, and it straps around them. So this is for a child who may not be able to sit up without some, a lot of support. We also have this, which is almost like a large potty, but again, it sits on the toilet. This has the cup, again, that can be removed depending on if you have a boy or a girl. It has a large tray on the front. A lot of times children actually prefer to lean forward for some leverage while they're pooping. So it's actually kind of an unusual position and you wouldn't think about it, but sometimes children will have more success that way. So the knees up is important for getting that leverage, but also sometimes sometimes they prefer to hold on to side handles, or sometimes children prefer to lean forward, and that's why that has the tray on the front. Similarly, this has the tray on the front. Then we have this little one that actually just attaches to a toilet and straps them in. So this just gives them some support from falling forward if children are not able to sit up on their own or not feeling comfortable sitting up on their own. And we have just a little, this is like the insets, but this is a traveler one. You can get this at drugstores and places. This is available commercially. And it folds, as you saw Anna just unfolded it, but it's something you can take with you. It has a little travel bag, and so you can always give your child support even when you're in the mall or wherever you are. There's a little potty down in the front there that's just a standard potty like you get at Walmart. And the nice thing about this potty is it does have the side handles, and the lid flips up just like a toilet would. And it does come with a little cup for boys as well. This is nice because the blue part actually comes off the base and you can sit it on your toilet. So when you transition them from a potty to the toilet, they can actually stay in the same seat they're used to, but just go to a different level. And again, you would need the step stool if they were going to a toilet. I think that's all of the devices we have there. So those are just some more examples of adaptations, but just keeping in mind it really is important that they're well supported and seated comfortably. If you've made sure that everything else is okay, there's no medical reasons, they're comfortable, everything else seems to be, there's no extra stressors in their life and things should be going smoothly, especially as your children get older, it's good to let them see through natural consequences that it's better to use the toilet. And again, this is not punitive, you're not scolding them, you're not upset with them or showing frustration, but what you're just doing is neutrally getting them involved with cleanup and kind of showing them that it takes a lot longer to change a diaper and clean up and change my pants or change, whatever it is that they're wearing, than it does just to pee in the toilet or the potty and go back out and play. So you just want to kind of make it a little less fun for them to be peeing in their pants than it would be to go in the potty or the toilet. So that's just called a natural consequence where you don't have to do anything. Basically, you just help get them cleaned up and go back out, but they see it's actually not worth it. It's also good to inquire about how school or preschool are handling accidents as well. So again, the idea is to give very little attention for accidents, and so sometimes what can happen is there's lots of reassurance, especially if a child's working really hard at this, and they pee their pants and they're upset and they didn't want to do that, and don't tell mommy I've been doing so well. And you want to make sure that preschool and school and all the caregivers are not kind of reassuring and patting them on the back and giving lots of attention around that. Just very matter of fact, let's get cleaned up, try again next time, and back out to play. Very neutral. So again, it's boring versus party. Okay. So the other thing that I want to remind you about, and we've already talked about this, is just making sure that toileting is a natural part of the day. And we always talk about a first this, then that rule. Sometimes people call it grandma's rule. It could be anybody's rule. But the rule is that first they have to do something that might not be so fun, might be a little boring, but then they get to have fun. Then they get to do the thing they want to do. So it's the whole idea of first you have to go to the bathroom, but then you can go out and play. And we can use it for all sorts of different behaviors, not just toileting. And so you'll hear psychology people, and not just psychology people, daycare people, everybody talk about this rule. But it's a really important one because you don't want to give them the fun stuff and then expect the boring, because that's not going to work so well for you. So if you let them go out to play and say, but in 10 minutes you have to come back in and pee, that's not going to go over very well at all. But if you just make it a regular part of the routine, that first they pee and then they get to go out and play, then it's going to work in your favor because you're kind of holding the motivator. And but if you've already lost the motivator because they're out playing, getting them back in, they're not going to be very motivated to come back in. Okay? Another thing around problem solving is, and I've talked about how children are sometimes visual learners and sometimes verbal learners, but very often they're a combination of the two. Sometimes it helps to use visual cues for the sequence of toileting, and this is just an example of a visual sequence. You can see it's a picture of pulling down the pants, sitting on the toilet. You take 1, 2, 3, 4, 5 pieces of toilet paper, not a whole roll. When they're done, they put the toilet paper in the toilet, flush the toilet, and wash our hands. And this can be really helpful not just for children with special needs, but also typically developing children, especially if your children are busy children. It's sometimes pretty hard to remember the sequence. And you do want to ultimately work towards independence in toileting. So this is a nice way you can have this on the wall, and as they become familiar with going to the toilet, and you have, the thing I didn't mention to you is that it's also really important that the potty or toilet's accessible to them. So as parents, we often kind of childproof everything when we have toddlers, but when you get to the point of toilet training, you want to make the bathroom door, take the little plastic thing off the doorknob and have the bathroom door open. You can childproof the bathroom, of course, so not getting into cupboards and things, but you do want to have the toilet or potty accessible, because ultimately you'd like to have the schedule there, have them know how to take their pants up and down, and when they needed to pee, so they go into the bathroom, take their pants down, pee, wash their hands, and come back out. So, and I realize that's a step in the process. It's not immediate, but it's what we're working towards. It's okay to take a break from toileting for a while if you need to. Sometimes it can be pretty frustrating, and sometimes you do need to take a break and just step back and reevaluate. You know, are they ready? Have we done all that early preparation stuff? You know, did we spend enough time just introducing it? And are there other things going on in their life? And if you take a break from toileting, you don't have to kick yourself for that. It's okay to step back from it. But then as soon as you're able to kind of reevaluate and get back in there, that's important too, because you don't want to lose progress that you've made with them, and you do want to continue to encourage that these are your expectations and give lots of praise around that. It's also important to remember that toileting may need to be started later, and it may take longer with children with special needs, and that's okay too. That age range that we gave at the beginning is for typically developing children. Lots of times it's much later for children who have other special needs or disabilities. Just remembering that it's never too late to start, that it's okay to start even with much older children, even adults, and that it's really worth it, and all the same principles do work. That's what's really important to remember. So I guess that's all that I have to say about that. The only other thing I did want to mention, and then I'm turning it over to Anna to talk about a couple of specific issues around toileting, is that if you are finding that, you know, I talk pretty generally around toileting, but if you're finding that things like specific behaviors or specific communication difficulties or specific disabilities are getting in the way of these general steps working for you, that's where people like psychologists, occupational therapists, speech language pathologists are available to help you with this kind of problem solving around the specific difficulties that you're encountering. And that certainly any one of those professions would be more than able to help you with those things. The other thing is, just so I don't forget to mention at the end, is that these pieces of equipment that we've demonstrated, we borrowed from the occupational therapy department here. And for those of you who might have children with special needs, you're probably already hooked up with occupational therapists. And if you are, they'd be able to help you with getting special seating to help with toileting. But if you're not hooked up with occupational therapy, you can self-refer or request a referral, but you can self-refer here to the occupational therapy department at the IWK. And who you would ask for would be remedial seating, and they would be able to help you with getting what you need it set up. And sometimes you can borrow devices to try, or they can help you kind of come up with specific devices that would help make your child comfortable in the toilet. It doesn't have to be big heavy-duty devices like this, but even just insets or what have you. So they are available there to help you if you need extra assistance. Okay. So now Anna's going to talk about constipation and bedwetting.
Just wanted to chat a little bit about some specific problems, as Crystal mentioned, that you may come across in regards to toileting. One of the first ones, constipation and soiling. It's important to keep this in mind. If you've had a setback with your child, either you've been working on toilet training and it's never taken off, or maybe it was going fine for a while and then all of a sudden you have this huge setback where the child's refusing to sit on the toilet and you're seeing lots of soiling. It's really important to look into whether or not they're having problems with constipation. Children may refuse to sit on the toilet, and they may hold their stool in, especially if they've had an experience where they've had a really painful bowel movement. So it's something where all of a sudden toileting turns into something that they're dreading doing because it was something that was very uncomfortable or painful for them, and it's not something that's fun at all. So we want to look into that and see, so that you're making sure it doesn't turn into this huge, horrible thing for your child. Because usually what happens, if they get to the point where they're dreading going to the bathroom because they've had a painful bowel movement, or they're not able to get stool out when they do sit on the toilet, you get into this cycle. So so that they are worried about going to the bathroom, so then they wait and push it off, or they hold and they don't actually push anything out when they sit on the toilet. And then as they're holding the stool in, you get a buildup because they're not emptying. And then on top of that, it's getting harder and harder because it's not going out. And so they're getting more constipated. So then when you go back to use the bathroom again, it's going to hurt them even more when they go, and it's going to be even more hard and uncomfortable. So a few signs of constipation to watch for, and your children may have some or all of these, depending whether or not how bad it is and different things like that. But you're looking like some of the most ones people commonly know are just hard, dry stool, or if they're complaining that when they're going to the bathroom that it hurts, that would be another sign. Sometimes you'll see a little bit of blood on the toilet paper. Or you're seeing that they're going to the bathroom, but they're only getting a little small amount out. So maybe they're going every day, but it's just a tiny amount. Or maybe they're going for like 3 or 4 days where they haven't even had a bowel movement. So ideally, it'd be great for them to have a bowel movement once a day. That would be a good thing. Some kids even go more than once a day. There's different body types for that, so there's general rules. But if they're going more than twice, less than once every 2 days, you definitely want to look into that. Another thing that people may less often associate with constipation, but is actually can be a sign that they're constipated, is that they're having multiple stool accidents in a day. And the stool may even be soft and runny, and that's why people are kind of misled by that. And we'll talk about that a little bit more and what causes that. Also, sometimes you'll see skid marks on the underwear. So it's not a complete bowel movement in their underwear, but they're getting little bits that are wiping off on it. So basically, as I said, constipation starts when the stool gets hard and it starts to build up in the colon. And the problems occurs once you get a buildup there, basically the muscles of your colon start stretching out. So as they get fuller and fuller, you're getting this whole thing that the muscles are stretching out. And as it stretches out, you get 2 problems that occur as a result of this. One is that they don't have the muscle tone that they need to push the stool out, so it's becoming stretched and they can't push, so it's even harder for them to get the stool out, and it's hard stool on top of that, so it becomes really difficult. And on top of that, as the muscles are stretched out, the nerve endings in the bowel actually get less sensitive, and so you have this problem where on top of it being harder for them to get it out, your child either may not be hearing, like they get used to having the bowels full, so they're not getting a regular message to their brain, oh, you should go to the bathroom. Or if they do, it's a really quiet message. So if your child's busy playing or doing other things, they may have no idea they have to use the bathroom because their body isn't working properly to let them know that. So that's a very important thing to keep in mind if your child has constipation, because it can be very frustrating for the parents, and they're saying, why does my kid not try, and why don't they go to the bathroom, and all these things. And this is why their body's not telling them that they have to go. Just obviously this is a picture of the intestines, and just to reinforce with this, look how large the intestine is. Like, it does take up a fair amount of room. And it twists and turns and everything. So your child should be getting quite a bit of stool out when they have a bowel movement. So even though they may be a little person, you still want to make sure that they have a good amount coming out, because there is quite a bit of room in there for buildup. Sometimes what also happens, and this is where you get into the soiling that happens really frequently with constipation, is if your child has buildup of stool, basically they have this hard lump in their intestine, and then new fecal matter that's coming in actually comes and seeps around the sides of it and leaks out. So one, the child can't hold that in because it's really liquidy, and it also causes soiling. And then parents are saying, well, they're soiling every day, so they can't have much in there, but usually there's actually a big lump that's blocking it in there. So that's when you get into this kind of thing that can be a little bit confusing for parents when they're seeing this liquidy poop coming out, and they say, well, it can't be constipated, but actually that's what's causing it. Another thing to keep in mind is constipation can actually cause urine accidents. And 2 things happen there. If you have your bowels are full of stool, the pressure pushes against the bladder, so that can cause it so that it's harder for the child to hold the urine in. And on top of that, the nerve endings in the bowel are connected to those in the bladder, so if the signals are messed up, that they're not getting the sign to go to the bathroom, they may also not be getting the sign when they have to pee. So if you think your child is constipated, it's worth a trip to your physician. You want to rule out any medical side factors. There are some illnesses that can cause constipation, or that can be one of the symptoms. So just making sure it's nothing that's medically going on that's causing this. And also you want to discuss with your doctor what's the best way to get constipation under control. Depending how severe it is, they may be recommending medications like stool softeners, but they also may just say, you know what, you need to increase your child's fiber and clear liquids. And I want to make a point of saying, if you do want to help with constipation, you need both the fiber and the clear liquids. If you fill your kid up with fiber and you're not giving them enough water, that's actually going to make them more constipated. So you really want to make sure they're drinking a lot of water, and preferably not milk, because that can actually make you more constipated as well. So here's an example of some foods with fibers in them. You're looking at whole grain things. You're looking at fruits and vegetables, those type of things. Anything that has not been overly processed is good. So if your child really has been having problems with constipation for a long time, or they're really what we'd call backed up, that they haven't been getting enough out, they may require what we call bowel clean out. And this is basically something where you're under your physician's direction, the child is taking enough medication to just get everything out of the bowel. And that's something, don't do it on your own. Obviously, you want to consult and make sure that everything is medically okay and you're following the directions. But sometimes you have to just start with a clean slate. Another thing to keep in mind, if your child has had problems with constipation, it's really important to know that just because you do manage to get things flowing again, or you get the bowel cleaned out, they still are going to have problems after they've been cleaned out for a little while. So you can picture their intestine that's been stretched, and it's kind of like a balloon that's been blown up and then deflated. It doesn't go all the way back to normal. It's still kind of stretched out and loose. So again, they're still not going to have the muscle tone right away. They have to build that back up again. And the signal still may not be working for a while. So as a parent or a caregiver, you really have an important role to make sure, because your child's, again, not getting that signal to go to the bathroom, so they're gonna have to rely on somebody on the outside to say, time to use the bathroom. And that's important to keep in mind. Again, it's not them being oppositional or not wanting to try or not caring if they're not going. It's their body's not telling them. So if you have a child that has constipation, basic things to keep in mind. If they're on medication, they might need that to keep the stool soft. You want to avoid those painful bowel movements. Maybe you can control that with fiber and water. You also want to make sure your child's having regular toilet sits, and this goes back to them not getting the signal. So then you have to make sure you have it scheduled into your day so that they do have a time to sit on the toilet. And you want to make sure they're long enough so they can actually get some poop out. So 5 minutes is usually a good rule for that. Another really good time to do a toilet sit, if you're trying to figure out the time of day, is 20 minutes after a meal. Our bodies are hooked up in a way that when your stomach fills up, your intestines say, oh, it's time to empty. So that's a great time, and they're more likely to have success then. As Crystal talked a lot about rewards, this is very important. Again, if your child has had constipation, you want to give them rewards. If taking medication is tough for them, they should get rewards for that. For sitting on the toilet, even if they're not always going every time, and for everything they can produce. So anything they can get out, you want to really reward. Because again, this is something that's really hard for your child. If they're not getting the signals to go, that it's really this abstract concept to them that, oh, I know I have to go, but how do I know when? So it's a tough thing for them to do. It's hard to get their heads around it, even if they don't want to be soiling and all of these things. Some parents think that their children don't care, but really it's more they just don't know how to get their heads around it. It's too complicated for them. Good idea also to track all of these things for, up to a few months after, if you've gotten your child back on a regular schedule. You want to watch what you're giving them for medication. You want to see how many toilet sits they're doing, when they're having accidents, when they're able to sit on the toilet and have a successful bowel movement, and also if they're having a bowel movement, is it hard, is it soft, how much are they getting out? And all these things are really important, because if you're not watching, constipation is one of those things that creeps back really easily. And so you really have to keep an eye on it to make sure that your child is going fine and that things aren't slipping back to being constipated again. So now I'm just going to chat a little bit about bedwetting. Change topics a little bit here. But there's first thing you should know is bedwetting runs in families. There's definitely a genetic link. If you have one parent who wet the bed, the child is 40% at risk of wetting the bed as a child. Both parents wet the bed as children, they're at 70% of a risk. If you are comfortable, it's a nice idea sometimes to share this with your child if you wet the bed as a kid too, so that they're not feeling this shame or that they're the only person out there. It's letting them know that this is a normal thing and we'll deal with it is very important. We also know that most children who wet the bed are deep sleepers. So it doesn't have to do with, oh, they had that glass of water before bed. That's one of those things that I guess it makes sense, common sense-wise, but that's actually not what causes kids to wet the bed. Unless you're feeding them like 2 liters of water or something right before they go to bed, it's not going to be a problem if they drink before going to bed. The problem is more in the fact that they sleep so deeply that when they do get the signal that they have to pee, they don't wake up. So they're just very, very deep sleepers. Another thing to keep in mind if your child is wetting the bed is most children grow out of this. This is something that is very common in children, and it's something that resolves itself even if you did absolutely nothing to deal with it. If you have a boy, they're more likely to wet the bed, and it takes them longer to grow out of it. So just little things to keep in mind. This is just a graph that is really interesting to look at the rates of wetting the bed, and a lot of people are surprised by this, because if you look at even up till 8 and 9 years of age, you have over 15% of kids are still wetting the bed fairly often at nighttime. So it's most of the time people don't talk about it, but it's a really common thing that's going on. The other neat thing about this graph is, as you can tell, as the age gets older, the graph goes down. These are the children that are growing out of it. So it's again showing that if you do absolutely nothing, the chances of your kid growing out of it are really high. It's by the time you're 18, it's less than 1% of children, or teens, I guess, are wetting the bed by the time they're 18. Whereas, like if you have a 6-year-old, 1/4 of them are wetting the bed. So that'd be something I wouldn't even think twice about. It's just a normal thing at that age. So if you do have a child who's been wetting the bed for a while, and again, maybe, I wouldn't start worrying about it until they start getting to an age where it's affecting what they can do. So maybe they're not going to camps or they're not going to sleepovers because of this. This is when it starts to be a problem, that it's impacting on their social life or how they feel about themselves. So if you do want to then look into things to do for that, first you want to make sure there's no medical cause for why they're wetting the bed. If they don't have any urine accidents or problems during the day, then there's probably not going to be a medical reason why they're wetting the bed. It's going to have more to do with genetics and being deep sleepers. Again, you can just wait until your child grows out of it if you don't want to deal with it. If everybody's fine with wearing the good nights or the pull-ups at nighttime and that works out well, then by all means just keep going with that. But if it's something that you really want to address, you can talk to your family physician about medication. The important thing to know about medication for wetting the bed is it's not a cure for wetting the bed. Medication that you can get out there, basically it reduces the amount of urine that's produced in the night. And it only works for the night that you take it. So it's stopping the body from filling up the bladder, basically, is what's going on. So it's a fairly safe medication. You do have to make sure your child's not drinking tons and tons, because if their body's not producing urine when they're drinking all that, that can obviously cause a problem. But other than that, this is something that some kids or parents may use, like if their kid wants to do sleepovers or camps and not worry about it, maybe they'll take it for that night. But and some people will take it more long term, depending while they wait to grow out of it. But it's something that when you stop taking it, they'll go back to wetting the bed, because it's just something that works for that same day it was taken. Another thing that you can do is you can use what they call a urine alarm, and there's a web page here where you can purchase them if that's something you'd be interested in. A urine alarm is, and I brought one here with me, which I'll demonstrate to you how it works. But basically what it does is it teaches your child to wake up to a full bladder. So this is something that's neat, because it's actually going to change, and it can get it so that they're no longer wetting the bed. So if your child is not waking up because they have to pee, then basically we want to teach them to start waking up to the signal. So this is basically the alarm. It looks like this. It's a small little device. It has a pin on the back. You pin it to their t-shirt or to their pajamas, wherever it goes, and then you have this device here at the end, and it clips into their underwear. You can even have a pull-up if you want, but you have to make sure you clip it on the inside then so it can detect moisture, and that's what it's intended to do. So basically what you do is you have this set up on the child. They go to bed with it every night, and I'll let you hear how loud it is. Basically what happens is when the tip gets wet, it goes off. And then the neat thing about this, in order to turn it off, I flip both the switch here and I pressed a button here. And that's really good for kids that are deep sleepers because it's not like the snooze button that you can just turn it off and ignore it. They actually have to get up, get their pants down, clip the thing, and press the button to turn it off. And this is good because in order to teach them to wake up, after the alarm goes off, you have to get your kid out of bed. They have to go in the bathroom, try to use the bathroom, change their clothes if they need to, or their pull-up or whatever they're wearing, and then hook it all back up and then go back to bed. And this is a process. It takes a bit of time. At the beginning, like this, I don't know if anybody thought this was loud or not. A lot of kids will say, oh, that wouldn't wake me up. And at the beginning it maybe won't. They're such deep sleepers. So that's when the parent's job comes in. So they hear the alarm. They have to go and make sure the child wakes up. But it does work if you keep this going. If you're consistent with it, eventually the child will start waking up to the alarm. And it's a gradual process. And basically what happens is they start waking up to the alarm, but they're completely soaked. You still get them to go through to the bathroom, coming back. Then eventually they'll start waking up to the alarm when it just starts going off. So they haven't finished emptying their bladder. So then they can get up and finish in the toilet and come back. And gradually, the brain starts getting more and more aware. It's anticipating this. I don't know if any of you ever wake up before your alarm clock in the morning, but it's the same concept that your brain gets used to being woken up at certain signals. And eventually, the child will wake up before it even goes off at all. And so it does teach them then to wake up to the signal so that they don't wet the bed anymore. And the difference between that and just waking your child up randomly throughout the night to try to get them on the toilet is that this is connected with the feeling of the full bladder and the signals to go to the bathroom, whereas the other is just a random chance. You might catch it, you might not. It can take up to 3 months because you're gradually retraining the brain to be aware of that signal, but it is effective in about 90% of cases. So if you have the energy, and again, you have to be prepared to do this because you're getting up in the middle of the night with your child to do this. And just remembering back to the chart, if your child is still 6 or 7 years old, I would wait before they get a little older before you start dealing with this because they'll probably grow out of wetting the bed. So basically, that's what we have for our talk. A lot of this can be hard work and a lot of effort, but it is worth it for both you and your child in the end.